morning rounds, our look at the medical news of the week. First up, a worrisome rise in the occurrence of liver cancer. It's been increasing since the mid-1970s, and according to a new report conducted by the American Cancer Society, liver cancer death rates are rising faster than any other form of the disease, with the death rate doubling since the mid-1980s. The American Cancer Society estimates that this year there will be nearly 41,000 new cases and close to 29,000 deaths.
Here to talk about it is CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Tara Narula. Good morning to you both.
Good morning.
Tara, did the report give any reason for the rise in liver cancer?
Well, the interesting thing about liver cancer is that 60% of it is attributable to potentially modifiable risk factors. Some of those risk factors have been increasing over the past few decades, things like type 2 diabetes and obesity. In addition, alcohol plays a role. We know that there's a 10% increase in the risk per drink per day, and smoking, which we think of as associated with lung cancer, actually increases the risk of liver cancer by about 50%. And then you have to think about hepatitis B and C. Globally, hepatitis B is really the biggest cause of liver cancer. In this country, really only the cause of less than 5% of liver cancers. But hepatitis C, very prevalent, high numbers in that baby boomer population, those born between 1945 and 1965. They actually account for about 80% of the cases of hepatitis C in this country.
Dr. LaPook, there were significant disparities in terms of who was affected by this. What can you tell us about
that? And you know, as I'm listening to you, I want to point out to our viewers, we are talking about cancer that starts in the liver, not cancer that starts somewhere else and spreads to the liver, which of course is deadly. But yes, there are a lot of racial disparities, ethnic disparities, as with other cancers we're seeing. And the lowest death rate was in whites, then blacks, Hispanics, Asian and Pacific Islanders, and the greatest death rate was in American Indians and Alaska Natives, and their death rate was more than twice that of whites, and it's felt largely due to differences in these risk factors that Tara was talking about, and to some extent to access to care.
Tara, did the authors suggest there was any way to reverse these trends?
Well, it's important for us to look at that because the prognosis for liver cancer is not great. We know that survival 5 years after diagnosis, about 1 in 5. So clearly we can affect these modifiable risk factors, so better control of diabetes, weight control, decreased alcohol, avoiding smoking. And then when you look at those hepatitis factors, you want to make sure that people are vaccinated for hepatitis B, which became part of routine childhood vaccinations in 1982. And for hep C, we need to do a better job in terms of surveillance and screening. The CDC recommends that everyone born in that baby boomer generation get tested at least once. And then treatment. In 2014, we have new oral drugs that can treat hepatitis C, very good cure rates, low risk, low side effect rates, and so that would be important. And then finally looking at populations that are at high risk and really targeting those, so people who are incarcerated and those with needle sharing to try to avoid that as well.
Good words of wisdom. Our next topic, something we all experience, stomach problems. A recently released survey by Merck Manuals, part of the Merck pharmaceutical company, looked at how Americans deal with digestive discomfort. A little over 2,000 American adults participated. The survey found that nearly a quarter of people experienced digestive discomfort once a week or more, and only 16% who experienced digestive discomfort visited a doctor. This sort of doesn't surprise me, and yet it surprises me. Dr. LaPook, what are the other findings here?
Surprising. Well, about 45% tried to treat it themselves with over-the-counter medicines. About 35% adjusted their diet. About 27% just dealt with it. They just, I guess, toughed it out. And about 22% sought some sort of alternative medicine, some natural remedy.
Tara, what kind of strategies do people have for trying to eliminate foods from their diet?
Well, about 18% just eliminated them right on the spot, with the ones that they thought were contributing. About 47% decreased their exposure to things that they thought they might be intolerant to. 32% conducted their own research, and about 13 to 14% talked to friends and family or tried taking medications, as John mentioned. But I think the important thing is that lots of times just seeing a doctor and getting tested and going over your family history and what your triggers might be is really more important and can be beneficial than people just suffering and trying to diagnose themselves, running to the bathroom, as they mentioned, embarrassed, dash to the bathroom, overstretched pants. Gurgling stuff.
It's something that so many Americans deal with, Doc, and it's your field, your expertise.
Yes,
what's surprising to you in all of this?
Well, what stood out was how many people have a gastrointestinal problem, and then how few people seek the help of a doctor. They said a doctor in the survey or other clinician, I would say, can also help. I am a gastroenterologist. I am biased. One of the reasons why you do need to go to somebody, a clinician, is that there are so many different things that can cause gastrointestinal problems. I mean, it could be stress, it could be diet, it could be some underlying problem like inflammatory bowel disease or celiac disease. Very often diet, if you're lactose intolerant or some other thing. The way to handle this is to go to somebody, have them sit down, and very carefully, slowly go over your diet. It's very tough to figure it out yourself because there are so many different factors. I take people through their day. What do you have for breakfast? What do you have for lunch? And very often something will come out, and it's such an amazing feeling to be able to, somebody will come after 20 years, and it's something simple. It's just like, you have lactose intolerance. And so it's one of the reasons why I love being a GI is you can really help people. If they don't come to you, then it's tough to help them. But which is why I like morning rounds, because we can go to them.
Right. All right. Finally, they're often considered part of the family, but along with companionship, can having a dog improve your health? Well, a new study published by Biomed Central looked at the impact of owning a dog for people 65 and older in the UK. The study found owning a dog led to an average 22 minutes of additional walking time, and dog owners had significantly less time when they were sitting.
What about cat owners?
Does it count for me if my wife walks the dog? Can I get the credit?
I'll give you points for that.
No, your osmosis points. But I would say, go get a dog. They're great. Adopt one.
I love my dog, Ash, little Ash.
Doctors Jon LaPook and Narula, always good to see you. Thanks for your time.